So I'm going to talk a little bit about my experience. And so I'm a clinician, but I do research and have been working for almost, I'm embarrassed to say, almost 30 years with people with PWS, and have seen several hundred people with PWS. And Elizabeth Dykins and I have always been very interested in this idea of obsessions and compulsions. We work with a lot of drug companies, like with DPAN, trying to figure out how best to come up with like kind of outcome measures, what works, what doesn't work. And this often comes up about OCD, right? Is it OCD? Is it anxiety? Like, what exactly are we describing? And I think for a lot of people, we're describing kind of the same thing. And I think for a lot of it is trying to figure out, what is it? Is it a diagnosis? Is it a symptom? That kind of stuff. So I'm going to talk a little bit about that and maybe some of the kind of confounds and other kinds of things that get in the way. And then I'm going to kind of head it to you guys about your perspective about what is real, what is not real, because research puts a lot of ideas out there that I really want to kind of focus on. Is it real? What is going on here? So is there an O, and is there an obsession in OCD? And for us, and I'm sure you guys feel the same way, people with PWS don't wash their hands 100 times because they're worried about germs and that it might kill their mom. Like, they don't have this real idea about why they do it. A lot of them, if you can get them to describe it, they'll say that I have to do it. I feel compelled to do it. I have to do it till it's just right. It's not that they're neat. They're not like, stacking books and everything's just neat and organized. It can be a real mess, but they have certain ways that things need to be, and they're very intense about it. And then idea of looking at brain structures and how they kind of see the world, the uncertainty, they kind of impose a certain need of control and order, even though it may not look like it, on their own life. And so can you measure it? So the idea of doing like clinical interviews, like things like KSADs or kind of semi-structured psychiatric interviews, like people with PWS aren't always great reporters, right? They often tell you what they think you want to hear or what they believe to be true, but that may not be always very correct. And parents often don't sometimes see these as being psychiatric problems. They really see them as much more as under the control of their kid, right? The kid should be able to stop doing this thing or stop asking that annoying question or not doing these things over and over. But that perseverative loop that they get stuck on, I feel like a lot of it feels very soothing to them. So the idea that they're doing it over and over to create some level of like, kind of decrease anxiety doesn't really seem to be the case. It really feels to me that they feel compelled to do it, but there doesn't seem to be kind of an obsession that's driving it. And if there is a compulsion, what does that look like? Again, they're not neat and orderly and perfectionistic. Like, that's really not what we see. It can be repetitive skin picking. It can be repetitive questions. It can be doing things in a certain order. It can be really slow in the way that they have to do things. So again, it's trying to figure out what we're talking about, what we're describing it, and is it sensory seeking? Like when we talk about some of the things that they do, like rubbing their hands together or touching their hair, is that an idea? Is it self-soothing? Is it like kind of deviant grooming? What exactly is going on? Or is it an idea that when they do those things over and over, that it somehow dissipates some of the anxiety? So again, we're not really sure what some of those things mean. And is skin picking a compulsive behavior, or is it something else? Because when we talk about it being, like, parents will often say, oh, my kid's picks to the point where we have to go to the hospital and get IV antibiotics, or we have to treat it with medicine or whatever else, or we can't really cover these sites because they're on their face or whatever else. It's really interesting to see, is that compulsive behavior? Is it something else? And I don't think we really know. Every time we try to figure out if skin picking goes into OCD, we find that it's its own specific behavior, and it doesn't seem to be driven in the same way. Like, people who are anxious don't skin pick necessarily, although they can do it because they're bored. They can do it because they don't have anything to do. They can do it because they don't even know they're doing it. And it is a way to kind of self-soothe. So again, that pain tolerance and some of those other brain changes that we know are true seem to be driving some of those. And also, what about subtype differences? We find that if you know the subtype of people with PWS, the presentation can look really different. And I find it interesting that we kind of like blanket say, oh, it's PWS. There's definitely some differences there as far as compulsive behavior and skin picking. So those are kind of the broader questions. And some of the problems that come up often when you look at research into these things is that they don't have really big sample sizes, right? I mean, they always say it's a rare genetic syndrome, so I only have 20 people. And I'm always kind of like, right, but 20 people with PWS that come into a clinic, how representative are they of the kind of general population of PWS? And the idea of looking at clinic populations, kind of, who kind of comes through your doors versus online questionnaires that may capture a much broader consensus of people, and also a lot more variability. So I think sometimes it's like how you measure it and what you do with it, the age of the participant. Some people are doing some of these behaviors as early as 3 or 4 years of age, and it continues on through adulthood. Other people have very few compulsive behaviors. I see a lot of adults that have very few compulsive behaviors, and it's never been a real problem for them. So again, it's looking at children. We know from our research that some of these things go away or they lessen over time as people get older. And when I say older, I'm talking about like late 20s. We really start to see a mellowing of some of these kind of obsessive and compulsive behaviors. We also see gender differences, that girls do different things than boys, and this idea that some of those things are also part of the kind of general picture. And it's not something that people talk about much, that gender subtype differences, age differences, all those things matter. Also, who is the person doing it? Is it a clinician reporting it? Is it a parent reporting it? You guys see lots of parents who will say, this behavior makes me crazy, and they'll go on and on about it. But when you take it apart, it's actually very adaptive, right? If they're checking to make sure that their books are in their book bag or they have all their pencils, it can be very time consuming, but it's also sometimes an adaptive behavior to make sure that they have everything that they need to get to school and have all the kind of supplies that they need to do, like, an activity. So it's for us trying to figure out what is the problem, who is reporting the problem, and how do we see that? How best to measure it, and how do we report it to people? Because again, I think we're often using different ways of explaining things that are the same behavior. So I really would love for us to get to a point where we're using the same language, we're using the same kind of descriptive terms to come up with ways to measure these things. I read a really interesting study kind of based on that, where they had 27 adults with PWS. It was a clinic population. They kind of did genetics, and they had that 7 of them were type 1, 13 were type 2. So that's the larger deletion is type 1, the smaller deletion is type 2, and then 7 with UPD. They talked about how many were taking medication, a lot of them. So again, just like Deepan was talking about, some are on SSRI, some are on anti-seizure medication, some are on antipsychotics, and one person was on a benzodiazepine. So again, they were definitely on medications, and they used the compulsive behavior checklist, the SIBOX, the repetitive behavior questionnaire with caregivers, right? So this is kind of how they measured it. And they came up with some really interesting findings that I'm not sure are entirely true. And I can't decide kind of where it falls apart. And I don't know if it's the number of people, which is kind of what I think it is, or if it's something else. But I love the fact that a lot of people want to use the SIBOX as a measure for OCD, right? And it's great for people who have general OCD, but having used it for several drug trials, I find that most of our folks don't hit any of the things until we get to the weird miscellaneous things. Doing things over and over, doing it till it feels just right, skin picking, all those things all hit those weird little things that don't hit any OCD symptoms until you get to that last ever. So I think we're not really necessarily using the best measures to actually figure out some of these things. So here they talked about 76% of them of type 2 had more compulsive behavior than type 1. Well, if you notice that first slide, you have twice as many type 2 deletions as you do at type 1. So again, there's some things I think they're not controlling for, and I necessarily don't find that they're that different. And those with UPD, they found less compulsive than those with type 2. I kind of want to know your take on this, because I don't find that to be true. My folks with UPD are much more compulsive, much more driven. They sometimes have fewer food issues and much more psychiatric, behavioral, and repetitive behavior issues. So again, I thought it was really interesting that this study, relatively new, showed that people that had deletion were more compulsive. And the top compulsion was skin picking. Do we believe that skin picking is really compulsion? I don't know. I'm going to kind of ask that for you. They also talk about ordering and cleaning. Again, I don't see kids with PWS being especially orderly or clean, but again, I think you can sometimes take some of their behaviors and kind of squish them into these categories. So I kind of know from your perspective, do these match your observations and expertise with this population? Are we using the right instruments to measure these symptoms? And can we really diagnose with them? Or what we're really doing is describing a cluster of symptoms. So that's kind of where I'm going to leave you guys. And I kind of want to see what you guys think about those things and talk a little bit about, are we measuring it the right way? What are we talking about? And does this study represent your general kind of clinical expertise in PWS? Is this what you see, that people with deletions have more compulsions than people with UPD?